Hi, this is Dr. Mary Kathleen Figaro coming to you from the Diabetes Channel, and today I'd like to discuss a recent article that came out in the Journal of the American Medical Association about how bariatric surgery has helped patients with type 2 diabetes lower their cardiovascular risk, lower their chance of having a heart attack or a stroke. First, you must know that as an endocrinologist, I prefer things that are not surgery for weight loss because there are complications of weight loss surgery. However, there is clearly a subgroup of people who benefit from gastric bypass and other surgeries for obesity and who do much better after the surgery occurs. This was a somewhat controlled study so that they did have a comparator group of people to those that underwent gastric bypass and other gastric surgeries to help with weight loss. And they followed these people after they had gastric bypass or other surgeries, and those that did not have any such surgery and were similar, and found that among those that had surgery, they were less likely to have a heart attack or a stroke. So let's unpackage this a little bit, because this was not a study in which they chose to put people either in a control group or in a surgical group. People themselves chose to have surgery. And while this was a database study, there are real reasons why people choose to have surgery versus not have surgery, which might have factored into how the outcomes showed between the two groups. In the group that had gastric bypass, the people were sicker. They had more comorbid conditions. They had more other medical problems like high blood pressure and high cholesterol and arthritis and sleep apnea. In the people who didn't have surgery, they were slightly older, so they may have had diabetes for a longer time period, and who knows why they might have chosen not to have gastric bypass. We don't even know if they were actually approached with the idea of having gastric bypass, because this was not that kind of study. This was just a database study looking at people who did and did not have gastric bypass. There's some real limitations to the study, and I'm not going to go into all the limitations of the study, but suffice it to say that in 2019, when I, as an endocrinologist, I'm talking to people about weight loss, I must, in the back of my mind, consider whether they might or might not do better with gastric bypass or other surgeries such as gastric sleeve in order to lower their weight and perhaps reverse their diabetes. What might be the things that I might consider that would make a person a good candidate? Well, being motivated to change their diet because there are big dietary changes that need to happen after gastric surgery. Having done well on a class of drugs that lowers appetite and having lowered their weight even before surgery, which shows that they can modify their eating habits on their own to lose some weight. Third, having a lot of other comorbid illnesses that we could reverse, and earlier in diabetes, I must say. As later in the course of diabetes, even if you have gastric surgery, you may not reverse your diabetes because you do not have enough cells that make insulin. You've lost enough cells so that even if you have surgery, you still have a problem with diabetes. So those are things that would make me consider a patient for gastric bypass when I'm speaking to them about weight loss when they have type 2 diabetes. Things that would make me less likely to suggest they have surgery is having diabetes for a longer period of time, having a little less weight to lose, because I know that there has to be a lot of weight to lose for there to be an improvement after their gastric bypass. And frankly, people who seem to have eating disorders, people who have a problem with controlling their diet, controlling how they eat, people who eat a lot after 5 p.m., people who have stress or emotions or anxiety that lead them to eat more and who have a hard time controlling that. And I think also people who have less support, because once you have had a gastric bypass or have a surgery, the ways in which you have to take care of yourself, the ways in which you need others to take care of you, require more social support. And so perhaps if a person has less of that support around, they're less likely to benefit from surgery, and I would be less likely to recommend surgery. Certainly patient preference, there are people who certainly would not want to have surgery, and in those patients I would not recommend it. There are many ways to lose weight. It's just that their effectiveness is dependent on how persistent you are Or are you thinking in terms of a diet, or are you thinking in terms of a lifestyle change? If you are to lower your intake of calories, then you must maintain that lower calorie intake for the rest of your life. It is very difficult to do. Many people do not have enough discipline, do not have enough social support, do not have enough limitation, or have limitations in their ability to afford expensive foods like fruits and vegetables, which are more expensive than processed foods. So for that reason, even if they do have success in losing weight, they tend to regain. And even in people who have had gastric bypass, there are about 25% of people in a 10-year period that regain the weight that they've lost through gastric bypass. So, in summary, the recent article in the Journal of American Medical Association suggests that people who undergo gastric bypass or other obesity surgery do better than those who do not when being compared to a similar group of people. This was not a controlled trial. This was a database analysis. And the factors that are not able to be evaluated in the study include such things as social support and eating disorders that are hard to understand and hard to factor in when you're evaluating a person who has obesity and has type 2 diabetes. So this has been a video about weight loss and gastric bypass. If you enjoyed it, please give it a thumbs up. If you'd like to subscribe, please subscribe below. New videos every week.